So let's consider the clinical scenario of 5 horses with right hind limb lameness associated with osteoarthritis of the centrodistal joint. Horse 1 shows a mild toe drag, but obvious asymmetry of the pelvic excursion and a shortened cranial phase of the step, and is a grade 4 out of 8 lame. Horse 2 shows less obvious asymmetry of the pelvic excursion, but a much stiffer limb flight and a more obvious toe drag, but is also moderate and therefore grade 4. Horse 3 moves on 3 tracks, drifting away from the lame right hind limb, and it has a more obvious audible irregularity of rhythm and was therefore assigned grade 5. Horse 4 showed axial deviation of the lame limb during protraction, a toe drag and a head nod when the horse was bearing weight on the diagonal of the lame limb, with only mild asymmetry of the pelvis. But this horse is also grade 5 out of 8. Horse 5 swings the limb stiffly outwards as it is protracted and shows the most obvious pelvic asymmetry, but has no head nod and maintains an audibly regular rhythm with no toe drag, but varies slightly in degree between questioning whether it should be assigned a grade 4 or a grade 5. When we look at the horse on the right, this horse was assigned a grade 5 out of 8 right hind limb lameness. In the left picture, we can see that there is axial deviation of the right hind limb during protraction. In the picture on the right, we can see that the horse is moving on 3 tracks. There was also an associated head nod. You can see that the head position is down when the horse is bearing weight on the diagonal of the lame limb. So hind limb lameness may induce a head nod mimicking ipsilateral forelimb lameness, whereas forelimb lameness may induce asymmetrical movement of the pelvis, usually mimicking a contralateral hind limb lameness, but sometimes mimicking an ipsilateral hind limb lameness. Horses don't always read the textbooks.